Imagine you are an elderly person going for a walk. Suddenly, your hip snaps and you fall to the ground. Unable to get up, a neighbor calls for help. At the emergency room, doctors determine you have broken your hip. They also determine that you have osteoporosis. Being unfamiliar with the disease, you wish to find out more. You wonder what it is, what its symptoms are, what causes it, and how it is treated. Because I have watched several family members battle the disease, I am prepared to give you the answers to these questions. Osteoporosis is an incurable disease resulting in loss of bone structure. When the body absorbs too much calcium from the bones, tiny holes are formed in the bone. These holes weaken and deform the bone and its integrity. When bones cannot rebuild properly, they are at risk for high fractures. Osteoporosis affects some areas of the body more than others. The spinal column, the hip region, wrists, and ankles all experience osteoporotic fractures more than any other part of the body. Several different types of people are at risk for this disease. Older adults make up the majority of those who suffer from this. 10 million people have osteoporosis, and 11 million more are at risk. Elderly make up the majority of osteoporosis sufferers because bone density naturally decreases as we age. Menopausal women are also at high risk for osteoporosis. Low estrogen levels take away the protective outer covering of the bone, making it easier for the body to steal calcium. Women make up 80% of people with osteoporosis. Those with a family history of the disease are also at risk for developing it themselves. People with malabsorption diseases, such as celiac disease, thyroid ailments, and Crohn's, should take dietary calcium supplements or risk bone loss. Luckily, there are several symptoms to look out for in osteoporosis. Unfortunately, this disease can happen for many years before this person knows they have it. The first sign is usually unexplained joint or bone pain, which are actually tiny fractures in the bone. Bone deformity, especially in the spinal region, is another warning flag of osteoporosis. Kyphosis, or Dowger's hump, is common in elderly people, which causes them to kind of hunch over. This hunching can take off inches from a person's height. Spontaneous breaks happen in severe cases of osteoporosis. When a person's bones cannot support their body weight, simple movements such as walking or even standing up can trigger a break. Luckily, several treatments are available for osteoporosis. Doctors may prescribe biophosphate drugs, which help to reestablish natural bone growth. You've probably seen commercials for these medications, which are Boniva, Reclast, Actonil, Fosamax, and Avista. For women, hormone replacement therapy is an excellent treatment for osteoporosis. This raises estrogen levels to near normal and helps prevent the bone covering from disappearing, helping to protect the bone. People on hormone replacement therapy do experience more heart attacks and strokes, although scientists aren't exactly sure how, probably because of the natural estrogen kind of interferes with the body's natural processes. Increasing calcium in the diet is another way doctors treat osteoporosis. Taking a calcium supplement, whether it's a pill or chewable, or in this case, Viactive, really help to increase the body's bone density. These are actually just chocolate chews that contain about 500 milligrams of calcium, which is about half of what you need in a day. You also want to take the calcium with vitamin D and magnesium for optimum absorption. Eating more dairy foods like yogurt, cottage cheese, low-fat ice cream, and drinking more milk are excellent ways to include more calcium in your diet. I have some pictures of osteoporotic bone. This here is what normal bone should look like. And this here is osteoporotic bone. As you can see, there are a lot of empty spaces between this bone, which really makes the whole bone weaker. And down here, this is also a magnifying picture of normal bone. You can see it's fairly thick, and to the right there's osteoporotic bone. Prevention truly is the best medicine when it comes to osteoporosis. As soon as possible, whether you're in your 20s or even in your 50s, make sure you get enough calcium in your diet. You don't want to get too much calcium, as this will result in painful kidney stones. Too little calcium will result in bone loss. You also want to make sure you get enough exercise. 3 to 4 times a week for about 30 minutes is an excellent way to build bone density. Weightlifting and high-impact activities like running, walking, or even swimming will help build stronger bones. If you're over the age of 50, and if you're a woman, you want to get regular bone density tests. This will help doctors determine if you have osteoporosis in its early stages so that they can better help slow the progression of the disease. Osteoporosis is a painful and life-altering disease that affects 4 out of 5 people who are 65 years old or older. There is no cure for osteoporosis, but by knowing what causes it, who is at risk, and how it is prevented, you can help reduce your risk of getting it in the future. Thank you.